A prepared statement from the families are present here today, and then we will be available to answer your questions. Of the 60 or so families that I emailed, this is the group that could appear. The reason for there are so few of us present here today is that so many of us are either grieving, trying to arrange and manage health care for our loved ones who have been transferred out of the Life Care Centre and admitted to care facilities close by, have been personally quarantined or have been quarantined or in self-quarantine. There's also a group who want to remain anonymous for fear of any backlash that might come from this. The small number of us present is a testament to the impact that this disease and the total lack of anything resembling containment has had on us and our families, and on our loved ones. Those standing here today are either the most fortunate ones, like myself, whose loved ones are not yet symptomatic, or the least fortunate ones, who have already lost their loved ones. We've been complaining for days at the lack of information we've received from the Life Care Centre, from the Department of Health and from the CDC. Most of us found out about this outbreak on the news. Even our loved ones were not told that there was COVID-19 outbreak. On the contrary, they were explicitly told it was a respiratory outbreak. Per the statement on their website, the Life Care Centre claim they are committed to keeping family members as up to date about the health of our loved ones as possible. To achieve this goal, each resident has been assigned a clinical representative who will be in contact with family members daily and respond to their requests for information about their loved ones. At 3:30 this morning, one of the people present here today was informed that their mother had passed away. 7 hours later, at about 10:30 a.m, that same person received a phone call from their assigned clinical representative to inform them that their mother was fine and was not symptomatic. When the family member corrected them and informed them that their mother had in fact died, the care representative simply stated that the chart had not yet been updated. 7 hours after a resident at the Life Care Centre of Kirkland had passed, the chart still had not been updated, and an already grieving daughter had to deal with the additional distress of being incorrectly told her mother was doing well. This is the level of incompetence we have been dealing with. What little information we receive is quickly conflicted by another source. We're being told that all CDC precautions and procedures are being followed, yet we wake up daily to news of another death. And while we believe that the Life Care Centre has been ineffective, we do not believe that they are to blame. They should never have been left to deal with this outbreak unsupported. And after the confirmed outbreak on Saturday, the first CDC representatives were not on site until Sunday. Even then, they only sent 3 physicians who are only sporadically on site. At no point were these people made available to us to answer our questions. To date, no one from the CDC or the Health Department has reached out to us and made themselves available for comment. When Vice President Mike Pence announced restrictions on testing would be loosened and that every American could be tested for this disease, I immediately phoned the CDC. After a near 2-hour wait time, I was told that operational procedures had not in fact changed and that my father-in-law would have to be symptomatic in order to be tested. When I voiced my concerns, I was asked if I'd like to escalate the issue as high priority. I of course said yes. I provided all of my information and details of my key concerns and was told it would be escalated as high priority. When asked how soon I could expect an answer, the representative told me I would have to wait 7 to 10 business days. 7 to 10 business days to find out if and when my father-in-law, who is a resident at this facility where there's an outbreak of a contagious, deadly disease, 7 to 10 business days to find out if he could be tested. We've been told that everyone at the centre is going to be tested, but we've not been told when. We've also not been told what will happen after testing. And so we have some clear demands. We want to know when our loved ones will be tested. We don't want general information about how and when the group as a whole will be tested. We want specific information as it pertains to our loved one. We want to know the efficacy of the test. Does the test work when the patient is asymptomatic, or does the patient need to be symptomatic? We want to know what happens after they are tested. What happens to those who test positive? What happens to those who test negative? We want those that test negative removed from the facility immediately, taken somewhere safe where they can continue to receive the medical supervision and treatment that they need until such a time that this centre is deemed safe to return to. We want details of the CDC team that are on site, how many CDC people are here, and what roles they are playing. We want confirmation that someone trained in infectious disease control is on site and driving operations at the Life Care Centre of Kirkland. The staff of the Life Care Centre have demonstrated that they do not have the training or experience required to contain this outbreak, nor should they be expected to do so. We want confirmation that adequate quarantine controls are in place to stop the spread of this disease within the walls of the Life Care Centre of Kirkland. If adequate controls cannot be put in place, we want our loved ones moved to a safe location immediately where they can continue to receive the treatment they need. We want a dedicated line to the CDC with trained professionals with up-to-date, accurate information who are available to us 24/7 to answer our questions. We want an audience with the State Governor, Dow Constantine, the Director for Public Health, Patty Hayes, the Health Officer for Public Health, Jay Dutchin, the Washington State Health Officer, Kay Loffey, and with Vice President Mike Pence. If these people have time to hold press conferences to answer your questions, they have time to meet with our families to answer our questions. We have questions and we demand answers. If anyone's questions should be answered, it's ours. There is a line and it starts behind us. On a personal note, my family are amongst the lucky ones. My father-in-law is still healthy. Many of those here today with me cannot say the same. I can no longer sit around and wait for a phone call to tell me my loved one has died. Our loved ones that live here are already amongst the most vulnerable in the community, and they are being left to be picked off one by this disease. It feels as if the CDC, the DOH and the government don't care about these people, that they are not considered valuable enough to waste precious resources on. We are here to tell you that they are, and we demand those resources immediately. No more delays. Thank you.
Thank you.
With that, I'm going to step back and let these people answer your questions.
Before you do that, could you name, spelling, and your relationship just for the record?
Kevin Connolly, Kevin, Connolly. My father-in-law, Jerry Wall, is a patient here. My email is kevin.a.connolly@gmail.com. My number is 425-785-2593. Thank you.
Hi, my name's Pat, and my mother's lived here for 7 years, and she loves it. In fact, they've helped to keep her alive. She would not be alive today if it weren't for them. They're exceptional. And it's a place for people that are older, that need care, and there's a lot of facilities that aren't this good. And so I just want to put that out that first and foremost. My mom loved to give roses to each one of the mothers in this place, including the staff members every Mother's Day. She loved to make sure that they got Christmas gifts too, and so she brought gloves and different things to all the team members. And my mother, I got a phone call this morning that she passed at 3:30 in the morning. So I am the person. She wasn't sick. She'd been really well. As far as we knew, she wasn't sick. So I was surprised. And the nurse that called me was exceptional. Again, if anybody could have called me to tell me this, I can't imagine it being any better. So I really want to emphasize that. I think this is such a bigger picture. I think it's tragic that they didn't have the support here to do the work that needed to be done in a good way. And I think that it's a larger issue with CDC, it's a larger issue with Mike Pence, it's a larger issue to take this seriously. And it's concerning now. How are we going to get these people out of here? If people are ill and even when they're asymptomatic, how do we get back to that? Anyways, so I want to say that this is tragic. I am so sorry for everybody involved. And I'm so sorry for us as a country, as a world. And we have to get on top of this. My mother would not like that I'm here today because she loves this place and wouldn't want to rock any boat. And I wouldn't be here if it weren't for her passing and realizing that this is so much bigger. This has got to get some support. And that doesn't mean that Life Care is doing anything wrong. I did get a phone call this morning at 10 a.m. from one of the people who now helps to call families every day and give them updates. And so, unfortunately, she told me that she's just updating me that my mother's fine. She doesn't have any symptoms. Her temperature's good. And she just is going ahead to update me. She'll update me every day. And I said, and what is your name? And she told me her name. And I said, that's bullshit. My mother died at 3:30 this morning. And she was shocked and regretful. And apparently the nurse that had called me, she was swamped. She was giving meds. She was doing temperatures. She was trying to deal with the coroner and everybody else to help get my mom out. And she somehow neglected to get all the information in the chart. So that's tragic. And I also have great compassion for her humanity. I've worked in healthcare. It's hard. And this is even harder. So please have some compassion for their humanity. Also, while asking that we get some support in a bigger way for all of this, I'm going to stop talking. Thanks.
Did you know your mom had any symptoms at all?
She didn't have any symptoms as far as I'm aware. Oh, one more thing. I'm asking and lobbying to make sure she gets tested. I want her body tested. And I've been told, well, we don't do that. We just have to assume that it's natural causes. And so I'm saying it's not okay. I need to have her tested for the larger picture, for everybody involved. As a society, we're learning more about this illness all the time. We need to know. And so I'm told now that the health department is considering that. I still haven't heard back.
What did they tell you was her cause of death?
Natural causes.
Nothing further?
No. And I said, well, we need to know if she's positive to this. They said, well, even if it's positive, it's a virus, so it's still natural causes.
When was the last time you spoke with her?
With them?
Your mom.
My mom. Last time I saw her was last Sunday, before the quarantine, and we talked daily a couple times, and she called me on Saturday, we spoke, and I asked how she was doing. She didn't really understand what was going on. She just thought it was another quarantine for respiratory flu, and then I said, has your nurse talked with you about what this is? And she says, well, I know it's a flu kind of thing, but this happens. And then Sunday we spoke, and she was really depressed. And I said, how are you doing? She says, I'm depressed. I can't get out of my room. She has 2 roommates. One of them was coughing. And she says, most importantly, I don't know when I'm going to get to see you again. And then I called on Monday and couldn't get through. And I called Tuesday morning and I asked, will you please let my mom know that I'm trying to get through to her? And could you see if you can get a landline to her so that I can talk to her, have her call me? And so the nurse was doing meds, and I get it. So she got back to me a couple hours later, and that's fine. But she wasn't able to get the phone to her. And then I called at 8 o'clock, and they said, oh, we just put her to bed. She's sleeping now. I said, okay, I'll call her tomorrow. Well, it's too late now. Anyways, so compassion for all involved, and we've got to get serious on this. And thank you.
Vice President Pence is in town, today, and I know.
Vice President Pence is in town today?
Or in the state of Washington.
Really?
A little bit later.
Wow.
As when you say that this is a bigger picture, if he was standing right here in his federal team, what would you say and what would you ask that you need?
I would say we've got to get on top of this. We have to take a bigger picture. This is bigger now than the virus. This is how do we contain this? How do we deal with people that are ill? How do we protect ourselves? But also utilizing the resources that we have worldwide, we've got to come together as a community and look at best practices for people that are living in facilities like this. We've got to learn from somewhere. Somebody's done this before. And I don't know, with him, I would just say this is tragic.
Between the families here, I mean, you're fighting community in one of the worst ways imaginable.
Yeah.
What are the conversations like that you all have with each other?
Well, I think some people are angry and frustrated, and I get that. And I have been more, well, let's have compassion for their humanity and all, and let's recognize that the healthcare workers have got a different experience going on, and they're also feeling beaten down, I'm sure. These are lovely people. And getting them the support. Actually, I got to go back to one thing that's really important to me. If you can get this on. One thing that would be most important to my mom in terms of a memorial would be to have us celebrate the workers here. So I'm moving to see if we can get that done. To bring gum, because she always go buy them packs of gum. To bring celebration for them. And also I talked to Beecher Hunter, who's the president of Life Care Center of America. He called me about an hour ago and said he said, oh, I am so sorry for your loss, and we made a mistake. And what happened with the nurse, and I said, my hope is that there's some systems that will be in place to prevent this from happening again to any other family. And he says, you can bet there is after this. And then he asked me to talk with him about my mother. So again, I appreciate the call, but what I told him is that what's most important to my mom is that we have this gathering to celebrate these people here that work so hard. And he said that he'll make sure that we have that. So I appreciate that.
Can you tell us your name?
My name's Pat, last name Herrick, Herrick.
And your mom's name?
Elaine Herrick. And it's 425-830-4115, shambo3@msn.com. That's SHAMBO, the number 3 at msn.com. Thank you all for being here and getting the word out in a good way. Thank you.
We're very sorry for you.
Appreciate that. Thank you.
Good afternoon. My name's Mike Wetherill. My beautiful mother passed away yesterday morning at 6 a.m. She was 85 years old. She was a very healthy stroke victim for the last 12 years. We just moved her here last September, and she came down with some coughing and wheezing around January, late January. And so they did some chest x-rays and they came back negative. And then they decided to put her on a nebulizer. And she responded pretty well to the nebulizer, and they then took her off that. And about a week and a half ago, they started the nebulizer again because she was wheezing and coughing. And but she was in good spirits. She loved this place. She loved the people, and they're great people here. I have nothing but the best to say about them. Things just moved real slow, and I think everybody just moved too slow to recognize this virus. So this is a picture of my mom back in 1979. Anyway, she was a very loving individual. She loved everybody. She raised chow chows, and that was her greatest passion, was puppy dogs and people, because she really loved interacting with people and talking to people. So she was doing okay as of Sunday. Monday she wasn't well, someone said, and then on Tuesday they called and said they were going to start giving her antibiotics, but she had no fever. The nurse said she asked my mom if she wanted to go to the ER. My mom said no. When the nurse called me, I told the nurse I wanted her to go to the ER, but she said she couldn't because there was no fever. The next day, later, early Wednesday morning, apparently she came down with a fever real fast, and they transported her to Evergreen Hospital about 4 a.m., and by 6 a.m. she had passed away. No family members were present. I was still asleep, and I had no idea what was going on until about almost 7 o'clock in the morning, when I started getting some more phone calls from the ER doctors, which informed me of her passing. Anyway, her name is Louise Wetherill, Weatherill, and she was 85 years old. Any questions?
Had you been tested for coronavirus?
They took blood samples and tissue samples and sent them off to the lab, and I have not heard back from them yet. I called them a little while ago, and they still have not received the results. But in my heart, I think she did pass from the COVID-19 virus. So the thing is out of control. It's obviously airborne. I don't want to freak people out, but they should be careful.
Are you worried that more people were infected by whether it was the CDC or Department of Health, or any sort of lapse in care that they provided?
Like I said, they're the best people here. I just think it took them by surprise. I'm not going to blame anybody. It's a real tragic and horrible thing that's happened. Do not wish that on anybody. Anything else?
When was the last time you were able to visit with your mother?
That would be on the 20th of February. I came back on the 21st to see her, but everybody was in the dining room. Well, not everybody, but a lot of them were in the dining room listening to a band, because they have bands once or twice a week. They really take care of their people here. And she was in there, and I didn't want to disturb her and disturb everybody else by walking in there. So I just peeked in the door and saw her. She was happy. Looked like she might have been sleeping, and which she does a lot. So, but she was very happy, and so the 21st was the last time I saw her. But the last time I talked to her was on the 20th. 22nd, I came down with something that hit me like a ton of bricks, and it really just about knocked me out. So I've been dealing with that for the last 11, 12 days. I'm finally getting better. I feel a lot better today, so that's why I'm here. Otherwise, I would not have been.
Do you blame anyone? You say you don't blame them.
I don't blame them at all, no.
You blame anyone?
How can you blame anybody for something that you can't see and you can't really deal with? I really wish the Chinese government might have stepped up and told us a little bit earlier about what was going on over there in Hunan. I heard through the grapevine in the news that they had taken their time in disclosing that, and I think that's pretty wrong of any government or anybody to do. They should let as many people know as fast as possible, because this thing has traveled so fast. It's unbelievable.
Mike, have you been able to get in touch with your doctor today? I know you were concerned.
My personal physician was too busy to see me, but I talked to another physician over the phone, and she prescribed me some antibiotics just in case I do have pneumonia, which I come down with maybe once a year. So.
Is there a chance you'll get tested?
I asked her about whether I should go to Evergreen and get tested, and she said no. I'm not exhibiting signs at all. I have no fever. I haven't had a fever. I don't know what hit me on the 22nd, but it felt like a ton of bricks it wiped me out. I was out for the day. And then I slowly started recuperating. Yes.
I think this doesn't seem insensitive. As you are awaiting the test results, are you having to delay any arrangements that you've been asked to do that?
Well, the rest of my family's too scared to come out and do anything, so and I've lost a lot of people in my family, so there probably won't be a funeral. We're just going to do a cremation, simple cremation, and my mom wanted her ashes scattered down by Mount St. Helens. She's a proud Cowlitz Indian, as I am, and that's where she wanted to be. Her remains scattered. So.
And who will be informing you about the test results?
Evergreen Hospital. Probably a doctor. They also said somebody else might call from the testing group, whoever that is. They didn't elaborate.
Did they give you a time frame?
They said anywhere from 1.5 to 2 days. So that would be anywhere from now till maybe tomorrow, late tomorrow evening. So.
Does that test result mean anything to you?
It'll just confirm that what I've known for the last week or so, because I was really scared when I heard about the COVID-19. I was scared that my mom might catch it, and then all of a sudden somebody did catch it and died. Or first of all, it was that one guy in Snohomish, and then I was like, oh gosh, it's here in Western Washington, and then somebody here caught it and died, and then I was really scared for my mother. So, is there anything else? It's Weatherill, Weatherill. Louise. Yes. My dad was here also, but I've got him at home and he's safe. I brought him home back in November, so he was here just temporarily recovering from a operation at the hospital, so he's fine now. Getting stronger, doing well. Okay. Thank you. Can I get through there? Thank you. Was that it for everybody? Thank you.
My husband is here for rehabilitation, and I just want to speak with you about what happened yesterday. He's had a consistent cough. He was muddled in his thinking, and I wanted him to be sent to the emergency room for evaluation, which took all day long to arrange. I worked with the 911 system, the Evergreen Health COVID team, and I was back and forth. At any rate, he was transported and tested last night. He was not admitted. His symptoms are not acute. And I realize there's probably limited beds for people that do have acute symptoms, so I understand. But I was called at 11:45 last night to say, do you want him to come home or go back to life care? No other rehab facility will accept him, given where he has been living. He's not walking well enough yet to come home. He had hip surgery, and that's why he's here, as I guess I just said. So our family was faced with a very difficult decision about sending him back here. So my point is what others have said. What are we doing with the people that are here that are healthy, that may or may not test positive or negative? This environment has not been healthy for many, and I'm fearful every single day that he may develop more symptoms. So help us get solutions for what to do with the people right now here in this, I'm calling it a petri dish. Thank you.
Thank you.
Oh, my name is Bonnie Holstad. Holstad.
Can you spell your first name too?
Bonnie.
And your husband was brought back this morning?
Yeah, in the middle of the night. There were evidently 3 people that were out to be tested or evaluated and had to return. Where else would they go?
What's your husband's name?
Ken.
Was he nervous at all about having to come back here?
As others have said, the nurses have treated him very well. So he wasn't nervous about their care, but he's aware of the risk of being in this environment. So, thank you. He's 73. He has complicated health issues, not respiratory, but others. So he's an at-risk individual. Thank you.
If I could just give a personal answer to a couple of questions I heard. You asked what I would say to Mike Pence. We're continually told that our loved ones are safe in this establishment. I want Mike Pence to come and sit with my father-in-law for an hour in this facility, if it's that safe. I would also say that the procedures that you guys have, that the CDC have in place, are not working. This disease seems to be contagious before it's symptomatic. Why are we waiting until people are symptomatic? And especially for a population like this, that's a death sentence. I think we're 0 for 8 right now, right? Everybody here who's been tested positive I believe that's the case, has now died. So if you're testing positive, why even move them, right? Like that, it's done. So I want Mike Pence, I want the CDC. The CDC need to change their approach to this. We've been promised tests. It's a day later and we're still no tests. I don't know how long it takes to get tests here. I still don't see a large CDC presence. And like I said, I'm one of the lucky ones. I'm waiting for that phone call and I don't want it to come, right? So that's why I called this today, because yesterday we were, one of the VPs from LCC told us that they had this new procedure in place, that we would have daily updates from a care representative that's been assigned to each of us. And then today Pat emailed me on that group thread and said, can you call me? My mother has passed away. I'm not trained as a counsellor, but I spoke with Pat. We were on the call together when she said, hold on, I have another call coming through. I think it's the care centre. She called me back 15 minutes later. She said, you won't believe what just happened. I've just had a phone call to say that my mother is fine.
She came back to life.
Yeah. And it was at that moment that we decided that we needed to up the game a bit and see. So, and then from an anger perspective, I know a lot of people have said they're not angry at the care facility. At the start, I was incredibly angry with the care facility and frustrated. My anger now lies squarely with I don't even know if it's the CDC or the BOH. I don't know, or the DOH. I don't know who we're supposed to be angry with. I don't think that the Life Care Centre of Kirkland have done a particularly good job, but I don't think they're equipped or trained to deal with this, and we still don't have the people whomever the people who are supposed to fly in and deal with this highly infectious, deadly disease. They're the people that I'm personally incredibly angry with, and I'd like to speak to them. I'd like to speak with them in the facility. That's where I want to speak with them. If this facility is safe enough for my father-in-law, I want Mike Pence in that facility. I want Dow Constantine's, any of them who have elderly parents. I want their parents in this facility. If it's safe enough for my father-in-law, it's safe enough for their parents as well. That's how angry I am, and that's how frustrated I am.
What changes do you want to see right away?
I want to see testing. I want to see they keep saying they're quarantined. They're not quarantined. They've been confined to their bedrooms, and even then they're not confined. One of the families reported yesterday that her father was out in the communal area walking around. My father-in-law was invited to walk around the outdoors if he wanted. This is not quarantine. There is no quarantine here. This disease is running rampage through this facility. It's a matter 7 to 10 business days, I was told, before I'll be told when my father-in-law will be tested. My father-in-law, at the rate that this disease is killing people in this establishment, will be dead by the end of the week.
Have you, it's a little hard to hear this, so Wendy's email said this way, if you don't mind me asking again. When you talked, are you able to talk to your father?
Yeah, absolutely, yeah.
He's a conversant, he can...
Yeah. So...
What is he saying about how he feels?
So when we first spoke with them, they hadn't been told it was COVID-19. They were told it was a respiratory outbreak. So he was surprised. At the time, all the staff were wearing masks and none of the residents were given masks. We were then told that masks aren't effective. Well, if masks aren't effective, don't wear them. And if they are effective, give them to the residents. Because if you're wearing a mask and when I spoke with the executive director here, she said those are the precautions we're being told to take, even though they're not effective. What you're doing is instilling fear in your residents, right? So at first he was scared. They're now limited with staff because people are quarantined, people are sick, and people are too scared to come to work. So the level of service they're receiving has diminished. So they're not showering them and washing them as often as they had been previously because they don't have the staff to do it. This is a disease that thrives in filth, and you have a population of elderly, infirm people who are now not being bathed at a regular basis. They weren't, there's hand sanitizer in there, but they weren't given individual hand sanitizers. So he's scared. He's Jerry. We lost Carol, my mother-in-law, last year after an illness of about a year, and Jerry spent 9 months in a chair next to her in a hospital, watching his wife of 60 plus years pass away. And after she passed away, Jerry then became very ill, and he was dying of a broken heart. So Jerry was brought here originally, and he was admitted into hospice in this facility. Jerry loves people. He loves the nurses here. He's a big flirt. He loves large quantities of mediocre food, and he gets all the chicken pot pies he can eat here. So Jerry actually graduated out of hospice at this facility. So Jerry is deathly afraid of hospitals, and equates this facility with bringing him, giving him his life back. So he doesn't want to leave. I'm going to kill him myself. I can't seem to convey the danger of the situation he's in, but it's his life, and I have to respect his wishes, and he wishes to stay here. Now, we were fortunate enough that I've been such a pain in the butt to these people that they offered us a private room. And the only reason there was a private room for Jerry, there was no private rooms in this establishment 2 weeks ago. You couldn't get a room here. The only reason now that there's a private room is that there's so many people have passed away. So he's in a private room. He has an 8-foot window so he can look outside. He's in good spirits, but which is why yesterday we were like, okay, we're in a better situation. And then I wake up this morning and get the call from Pat to say, my mother has died. So there is no quarantine here. There is no control measures in here. The people running this facility don't know how to contain this. They're not trained to. They don't have the experience to. Where are the CDC? Where are the trained professionals? Where are they? They're still not here. This is 5-6 days later. It was Saturday. What has to happen? I don't know what I need to do. I tried speaking to the press. It didn't work. Now I'm bringing you all together to do this press conference. If there's another death tomorrow, we're going to up our ante again, and whatever we need to do to keep my father-in-law alive is what I'm willing to do. And I want to speak to Mike Pence. I want to speak to Dow Constantine. They made time to speak with all you guys. Where's the time for the families? Nobody has reached out to us. Nobody. So I'm angry and I'm frustrated, and it's at all the people that I named when I spoke earlier on. Thank you. I learned that today. Yeah. I want him to come down here. I want him to come down here and speak to us. He's here. I think he's here because it's a presidential election year, right? I think we have limited resources to battle this disease, and I think somebody somewhere decided that this population of people wasn't worth wasting resources on. That's how it feels. Otherwise, I can't think of there's no other valid reason for the response that we were getting, which is 3 people who are here periodically throughout the day.
Nobody's ever even seen.
None of us have ever seen. They've never reached out to us. We don't have contact with them. I called and asked if I could speak with one of them. The VP of Life Care Centre said they're actually not on site at the moment. I said, well, where are they? He said, I don't know. So I believe Mike Pence is in, if he wants to be here to impact change, he needs to come down here and hear from us and let us speak to him directly.
Have any of you seen a CDC truck pull up here, or anybody in any kind of a suit come here? Any markings on a vehicle? Nothing, right? There's been no report of that. Where are these people?
And we were told yesterday there would be tests. Where are the tests? And after the testing, what are we going to do? We want to see testing. We want to see the people. I don't even know if can you test somebody if they're asymptomatic? We don't even know that, right? So if that's the case that you can't, then that would be an answer. Well, there's no point testing people.
You can, but they're just not allowing it to happen.
Well, and we're getting conflicting information. I want people tested. I then want them separated. Either all the sick removed from this facility and this facility cleaned top to bottom, and then move people around as they clean rooms, or take the sick away, take the non-sick away, clean this facility and move them back in, or leave them all but quarantine them. There's no quarantine. They keep saying quarantine. There's no quarantine. They are being loosely asked. They're not even confined to the room. They're being loosely asked to stay in their rooms, and they're not doing it.
May I comment?
Yeah.
My mother, Judy, is here, and we just admitted her last Wednesday night, and I'm curious about the timing of this because it was horrible to bring my mother here after 2 weeks of surgery at the hospital. She wasn't able to walk due to a blood clot surgery that she had, and she was brought here because this was the one place that had a quarantine room. She also had a stomach ailment that you get from having too many antibiotics, so that is the only reason she was placed in the quarantine room. She's down on the corner there. The first time I've seen her was 15 minutes ago because I walked down and knocked on the window. She looks like she's doing okay. I talk to her all the time. And she also praised the staff that's taking care of her. She says they're leaving loved ones at home to come in and do this for me. It's walking into harm's way, and she appreciates it, but she's also very frustrated because there's nowhere for her to go. If I pulled her out of here and took her home, I still couldn't send her back to her senior living center because I don't have a test that says my mom's okay. If I needed to go to the blood clot clinic myself because I pulled her out of here, I would not be welcome at the door. She would be shunned for having been at Life Care. So there is nothing that I can do, even though in my heart of hearts as a good daughter, I want to pull her out of here right now. I have nowhere to take her, and I can't carry her, and I can't I can't fix this, so I'm glad you're all here today to help us.
Did they tell you about the outbreak before you admitted?
They did not, and I'm curious about the timing because they were already having test results by Saturday morning, and we came Wednesday night to check in, and in all honesty, I wanted to pull her out Thursday morning, and I came up here with the intention to do that because she didn't want to be here, and I changed my mind because we had a meeting with several of the healthcare providers in the room, and I actually felt that these were the best people she could be with right now. They were good. They meant to take care of her, and they calmed her down from she was having a tantrum wanting to go home, but I will live forever with that tantrum because I meant to take her home. She wanted to go home, and we just got there when all this started, and now I can't take her anywhere. So my name is Lori Spencer. Lori Spencer. And my mom's name is Judy. And I just took a picture in the window and sent it to the family so they could see that she's okay. She's 81.
Her last name is also Spencer?
Shape. S-H-A-P-E.
Well, I moved my mom here back in June from the East Coast. So she could experience the beautiful Pacific Northwest and have a change in her life that was for the better from where she previously was living. And I never would have thought that something like this could have happened to her after trying to bring her to improve her life out here. People at the Life Care Center, the staff has been wonderful to my mom. She's happy here as much as one can be in a nursing home. They take great care, and as Kevin said, others have said, I don't blame the staffing here for this incident. What I do blame right now is the response from our government officials. When I was made aware of this Saturday afternoon on my way here to visit my mom, I assumed right away, okay, when I get here, there's going to be CDC trucks outside, or people here looking at the visitor list, seeing, oh, so-and-so was here. Oh, Curtis, my name's Curtis. You were here every day last week. You're going to have to get tested right now. No one's contacted me for any of that. I've had a hard time even to try to get testing myself, even though I'm a high-risk person to be tested. My doctor wanted me to get tested, and he can't even get me in to get tested. My mom, she's okay. She's not showing signs of any symptoms. But how long will it be before she does show signs of symptoms? Last week she was very lethargic, and I was concerned maybe she had some kind of infection. But these things happen when you're 89, where you go through little ups and downs, where you don't have good weeks, you have good weeks and bad weeks. I talk to her usually 2 or 3 times a day, and I am comfortable that she is safe in her spot right now, but I want her out and tested immediately. I want her to be somewhere else where she can be even safer and to really know that does she have it or not, and so we can move on from this. People need to imagine if this was happened somewhere in a large nursing home in downtown Los Angeles or in New York City. Imagine if the CDC is doing such a poor response on a small little place like this. Imagine what would happen if this happened large scale in a big nursing home where there's 400 or 500 people. My mom lived in nursing homes in New York where there was 600 people. Imagine if something like that happened there, and the CDC had such a poor response. And, like I said, we don't see any CDC people here. I tried to call the CDC coronavirus hotline twice yesterday, and the representatives didn't even know what I was talking about when I said Life Care Center on the phone. They said, what state is that in? Were there any cases reported? They said to me. I was like, what? What do you mean, were there any cases reported? Miss, are you living under a rock? Do you look at the news? Are you not in the coronavirus hotline center here? They did not know that this is happening here and there's people that are sick on the coronavirus hotline at the CDC in Atlanta.
What would happen if you insisted upon taking?
We can't take. You're not allowed to take them.
Sorry, we are.
Nobody will take her.
Sorry, I called Todd. So Todd's the VP of Life Care Center, who's now on site taking control of things. And I explicitly said, "Can I take my father-in-law out?" And he said, "Yes, you can." But then I have a young family. I'm not equipped medically. We don't have he has 10% heart function, so he needs to sleep in a special bed. He needs a shower stool. He needs to be bathed. He needs to be shaved. He needs to be fed. I'm not medically equipped personally, nor do I have the equipment to do that. If I take him out, I'm putting my family at risk. I'm putting the community at risk. So I can be irresponsible and go pull him now. We're being responsible here. We're the responsible ones. We can go pull all of our people now and spread this disease and make it everybody else's problem.
Right, and I would have nowhere to bring my mom.
But that's the question people keep asking. Kevin, why don't you go kick the door down and get him?
You to do that.
Yeah, absolutely. And on Saturday and Sunday, we were considering it, and I didn't know if that was even legal. Now we've been told that it is within our rights to do it. And myself and my wife discussed it, and we were like, but what do we do with them? We can't bring them to a hotel. If we bring them home and we try and hire in-home care help to help us, who's going to take that job? Who's going to come and care for an elderly person who's been in here for the last week? We have no options here. This is our only option. Sit and wait for a phone call. That is my only option right now, and this. Right. And then if this doesn't work, I've got to think of the next thing to do.
But no one has been tested as far as you know?
No one has been tested, unless they're symptomatic, and in which case, if they've been... Your husband has?
Because I took him out yesterday. He was tested.
After you took him out?
I had him taken to ER at Evergreen Hospital, and they did test him. But he's back here. It was correct.
If you're showing symptoms.
No, they tested him.
And he didn't have a cough? He didn't have a fever?
He had a cough, but he didn't have the acute symptoms. Okay. But if you can get him out...
See, this is what we're dealing with. We don't know. I didn't know that. I didn't know I could go get my father-in-law tested.
I was told from the Evergreen Hospital, no, do not bring your parent here. They cannot be tested unless they're sent here with the doctor's permission.
So my understanding is that if the doctor now says, we want you tested, then they will be tested.
Right.
As of a couple days ago. So there is that now.
But there's not sufficient tests available, apparently.
I agree.
Yeah. Okay, that's all I understand for this. Thank you. My mom's name is Mary. She's 89. She'll be 90 in June. And we were planning, when this is over, to take a little ride to the Pacific Ocean, over to Ruby Beach, show around the area there. Yeah. Luterman. Luterman.
And then my prayer is that in a week, if
Yes, it is.
something
Yeah.
happens, I'll regret not coming on.
Yes, she does.
That's the decision I had last night.
Thank you. And if
Thank you.
And then last night we decided against it.
So did we.
No.
You want to speak?
You do. I'm tired of talking. This is my sister-in-law. Her mother is here at the facility. She has severe dementia, so we don't know how she is. We can't talk to her on the phone. We can't get her to tell us how she's doing. We've been told when we call she doesn't have a cough, she doesn't have a fever. However, we don't know.
Yeah. Like everyone said, Life Care, the staff has been amazing. They really take care of the patients. But the corporate, they're in it for the money. They need to step up and, get these people tested. I was in there Monday, which I wasn't supposed to have been, but I went to the door and they did let me in. It was very eerie in there. The halls were empty except for a few workers. And they were just wearing their scrubs and they had those flimsy masks on. A lot of the doors were closed, so you couldn't see in the rooms. I assumed those were the sick patients. I went to my mom's room, and this was about 11:30, and she was still in bed. And that worries me. If they're leaving them in bed all day, their skin's going to break down, and that's going to cause more problems. She's a very social person, so being confined to her room, she can't move her wheelchair. She uses her feet a little bit, but that's solitary confinement. That's no good either. So, and Mr. Pence, please come and visit us right here.
Yeah, right, inside.
Yeah, inside.
And when we arrived on Monday, when she was able to go into the room, she had a roommate who was there I visited on Friday, up until Friday, who had pneumonia, was on oxygen. She told me herself that she wasn't bouncing back. When she went in to visit on Monday, the roommate is gone. And we because of HIPAA, we're not told whether her condition at all.
Yeah. And she was right next to the roommate. She brought her juice. She sat there and talked to her. So.
And we've called the Department of Health on Saturday. They said, no, you don't need to self-quarantine. Families don't need to do that if you are inside. Only if you're showing symptoms. We're not having symptoms ourselves. We've self-quarantined in our homes ourselves just to keep this from spreading to the community, the elderly, the medically fragile. Called again today, Department of Health is not recommending that the families be self-quarantined who've been in contact with respiratory people inside.
Colleen, Colleen, Mallory, Mallory.
What was the other family member relationship with?
My mom's in there. And she's apparently, when I saw her, she was fine. She doesn't have any symptoms. But, are we waiting for the phone call?
And we were told we all have a representative. She was called by her representative this morning. Unfortunately, we haven't been contacted by a representative today.
No.
My name's Anissa, Annissa. Last name Walsh, Walsh. And Peggy is my mother-in-law who's inside.
All right.
I think we're done talking.
If you guys could help us get this story out, guys. Our families are dying with this. We don't know what to do. our calls for help aren't working. So please, whatever you guys can do, no more phone calls, no more positive tests, no more deaths, please.
Right, we don't want to lose our people because of this, unnecessarily.
They do matter.
Wish you all the best. Of course. All right. Thanks, guys.
Thank you.
And them.
Announced that if the Fed's investigation determines that